Hello, Dr. KK here. Welcome to today's episode. We are going to have a little bit of a conversation on the early symptoms, early experiences of pregnancy. Usually the reason why people are scared to be pregnant is because of what they will experience in the early pregnancies. And then, aside that, what they will go through the labor pains. People are so scared of labor pains, and a lot of them are also scared of the symptoms they will experience in the course of the pregnancy, especially in the first days of the pregnancy or first months of the pregnancy, which is termed as the first trimester. Every pregnancy is divided into 3 trimesters. So the first one, the second one, and the third one. The first one comes with a lot of challenges because your body is now trying to adjust to the new being inside her. So it's with a lot of challenges, I must admit. And all these are explainable. They can be totally explained by science. And all of them are due to the presence of the fetus or what is in the womb. So that's how come people have those experiences. So when it comes to your gastrointestinal tract, that is your intestines, your stomach, and the other organs, the commonest symptom that a lot of the pregnant women experience is nausea and vomiting, and it can be very bad. Some are mild and they don't have any challenges with it, but a lot of them, it comes with serious problems, such that some cannot eat, they cannot even drink water. And that is something that can be explained because of the presence of what is growing in you. It's producing something into your system, and that's the reason why you are struggling to swallow even water. So it's fine. I mean, it's an experience that no one wants to have, but if it's unbearable, I would always advise that you see your doctor because it can be managed. It can be managed by your doctor. So when your nausea and vomiting is not tolerable, please try and visit your doctor to help you out, because understand that if you are not eating and you are not drinking, you become dehydrated. It can affect the growth of your baby. Your baby can be restricted in terms of growth if you are not eating well, you are not drinking enough water during the pregnancy. So if it's something that you cannot tolerate, kindly visit your doctor. Let them help you out. One other symptom that a lot of pregnant women experience in terms of their digestive system is heartburns. Heartburns is real, and it's also something that can be explained because the food finds it challenging staying in your stomach. There's something that stops it from coming up. It becomes relaxed when you are pregnant. So food can easily back up what we term as reflux. So it's something that you have to also take note of. And as I'm saying, if it's something that you cannot tolerate, kindly see your doctor. Let them manage it for you because pregnancy, though it's not so pleasant, especially in the early days, it can be managed. It can be made relatively easier for you. So always be in touch with your doctor who is taking care of you so that if there are issues that you are struggling with, they can help you out. And there are some times that a lot of pregnant women also, when it comes to constipation and diarrhea, it's so unspecific with pregnancy. So you may have your normal bowel habits. Some may have constipation, some may have diarrhea, but usually people have their normal bowel habits when they are pregnant. So aside the digestive system, the next thing I want to talk, I'm going to break this session into various systems because I don't want the video to be long. But aside the digestive system, the next system we want to talk about is the cardiovascular system. That's your heart and your blood vessels, how they are also working. Now, what is happening is that your blood vessels relax more when you are pregnant and your heart rate increases. So your heart rate goes higher, about 15 beats more than before the pregnancy. So if you are pregnant and you start realizing that your heartbeat is going faster than normal, it is part of the experience it's part of the changes that are occurring in pregnancy. What a lot of people experience also is that their blood pressures begin to come down a little. So if your blood pressure is coming down a little, it's as a result of the fact that your blood vessels are more relaxed now. So your blood pressure begins to come down a little, and it's normal in the pregnancy. So always, if there's something you don't understand, kindly visit your doctor. And if you are pregnant and you're watching this video and you don't understand anything, you can ask your question in the comment section, and I'll be glad to help you out. So basically, with your cardiovascular system, your heart rate goes up, your blood pressure begins to go down. You may get some palpitations. That is when you feel your heart beating very fast, or fast and hard. That is palpitation, and it's all part of your system trying to adjust to the pregnancy or what is new in you. So if you start experiencing these things, please, if it's something you don't understand, ask questions, ask your doctor, let them explain it to you, and I'm sure it will. So the reason why I'm saying all this is because your understanding of these concepts will help you appreciate it, so that you don't rush to the hospital in by the blink of everything. You are going to the hospital. If you understand some of these things, you'll be able to appreciate the fact that it may be normal and you don't have to necessarily rush to the hospital. Aside that, you may have some muscle aches, you may have some joint pains, which, I mean, if it's too much, I'm not saying you should stay in the house, go to the hospital. But so those mild pains are things that, especially you wake up in the morning, you feel weak, like you are struggling to move about and all. They all happen during the pregnancy. But if it's beyond what you can bear, please go to the hospital. Do not stay home and assume that it's normal. It may be something else. So always try and be in touch with your doctor so that they help you out with these symptoms that you may be experiencing. So last but not least is the respiratory system. That has got to do with your breathing. In the very early days of the pregnancy, you may not realize any changes with your breathing pattern and all. But as the pregnancy advances and your abdomen becomes bigger, the womb becomes bigger, you may be having some difficulties breathing because your womb may be pushing against your diaphragm. But in the early days, most of the time, there are not a lot of changes that you can realize with your breathing, even though some measures that are done in the hospital indicate some changes in your respiratory system. But what you realize may be the fact that there's some bit of effort required to breathe. And as your pregnancy goes on, you may not be able to lie on your back when you are sleeping. You may have to lie on your side and all that. So for your breathing, there may not be much with your breathing, but if you realize that there's some bit of effort required in breathing, you may not have to worry too much about it. Yeah, so with your brain, your CNS, there's not much. But one very important thing is anxiety. The anxiety comes from the fact that you are anxious about the pregnancy, you're anxious about how far it can go, you're anxious about the tomorrow, the next experience. I will advise that if you are pregnant, take one day at a time. Don't be worried about tomorrow. Think about today, surviving today, and then taking tomorrow each day at a time. It will help your mental health if you are pregnant. And most importantly, you need the support of your partner, or you need somebody to support you. Research has shown that women who have partner support in pregnancy do well, and they get a better pregnancy experience compared to those who are not receiving support from partners or from family. So for your mental health, you are greatly helped if you get support from your partner. So if your wife or your partner is pregnant and you're watching this video, I would advise that you give her the maximum support. There are some times that in terms of the mind and the mental issues, there may be mood swings. And this is very real for pregnancies, mood swings. Please, if you notice this in somebody who is pregnant, they are not pretending. It's part of the changes that is happening in their system. Please bear with them, understand them, encourage them, and support them, because the mood swings can be real. It's all as a result of the pregnancy hormones. So if you are getting mood swings, do not be so worried about it. Try always calm down. You may be easily triggered. That one, understand it. And whoever is living with a pregnant woman, understand that they can be easily triggered, and support them. Very important. Support them when it comes to those moody days that they don't want to talk, they don't want to do anything. Please support them, okay? So that at the end of the day, the person or she is going to have a better pregnancy experience. So yeah, as always, please subscribe to the channel, share with others. If you have any question, you can ask in the comment section. I'll be right here to answer all your questions. Signing off. Bye.